Hello again everybody. A quick update about the ReCerf ceramic resurfacing. It's now available for use at the Wessex Nuffield Hospital, which is where I work. As many of you know, I've been waiting a long time for this new device to be approved. I was involved with the early development of ceramic resurfacing, and it's taken nearly 20 years to get it to market. Back then it was called Delta Surf. ReCerf looks much the same. The material that it's made from is Delta ceramic, and we use this in nearly all hip replacements. It's been used for over 20 years and has an excellent track record. It's very tough and very durable, and it should be an ideal material from which to make a resurfacing device. So why are we so excited about ReCerf? Well, let's look at the history of resurfacing surgery in the last 30 years. The original metal-on-metal resurfacing was the Birmingham hip. That was the one that Andy Murray had, and he's done very well with it. I've done over 1,000 metal resurfacings using both the BHR and the Adept implants. These have been very successful in younger men with big bones and straightforward anatomy. They haven't done so well in people with smaller bones and where the hip anatomy is abnormal. For example, dysplasia. This is where the hip socket is slightly shallow, and it's much more common in women. These issues cause the metal surfaces to wear more quickly, causing a soft tissue reaction and sometimes loosening. The rate of failure in these cases is higher than in a hip replacement, so for many years we've not done resurfacing in women. The ReCerf should get around these problems because the ceramic doesn't wear in the same way as metal, and it doesn't produce debris that causes a reaction in the soft tissues around the hip. We'll now be able to offer resurfacing for active younger women who will now be able to benefit from a hip implant that takes away less bone and has a reduced risk of dislocation. It should also be more durable in the long term. I say should because we don't have any long-term data about the performance of ReCerf. There was a published series on 200 patients, including women, which showed an excellent result at a minimum follow-up of 2 years. There were 2 failures, one for unexplained pain and the other for loosening of the socket. All in all, that's very encouraging. I'm going to give a talk on resurfacing next week at the Bristol Hip Meeting, in which I'll discuss the renaissance of hip resurfacing. The concept fell out of favour because of the failures that we saw, and many surgeons stopped doing it. As a result of this, a lot of the younger surgeons have never done resurfacing. I've been a firm believer in the concept of resurfacing and have continued to do it in carefully selected people. I'm cautiously optimistic that the new ceramic resurfacings will be a great success. What do you think? Let me know in the comments below. If you'd like to know more about resurfacing and want to see if it's suitable for you, please get in touch. The contact details are in the description below. Thanks for watching, and I'll see you all again next time.